morning, and welcome to the Florida Prosperity Partnership webinar, Prosperity Campaigns and the Affordable Care Act, What You Need to Know. This webinar came about from the demand that our partners have expressed to us. So if you have something that you would like to have us do a webinar on, please let us know. This call is being recorded. And first, some housekeeping issues. You can view the webinar at freescreensharing.com. That's freescreensharing.com, freescreensharing.com. And the passcode is the same you used to get on this call, 225-498-695. If you are on freescreensharing.com and do not see the first slide with the title of If you are on freescreensharing.com and do not see the first slide with the title of the webinar, your computer has probably opened another window. If you click on the icon in the tray at the bottom of the screen that looks like two monitors back to back, that should pull up the presentation. Once again, there's a little icon on the bottom of your screen that has two monitors back to back, and that should pull up the presentation. If that doesn't work, or if you've received a message that says the presenter has not started the presentation yet, you may need to try to either log in again, otherwise you probably have had a firewall or a pop-up blocking issue. In that case, a link to the PDF of this presentation was in the reminder that was sent out this morning. If you are not on our distribution list, if you go to FloridaProsperityPartnership.org, all spelled out, FloridaProsperityPartnership.org. Click on Members and Meetings, and then Meetings, and it's right under the title for the webinar. You can click there, pull it up, and there's a PDF of the presentation. I would like for everyone to please mute your phones at this time. You can either use your own phone mute, or you can press *6. Okay, and then also, of course, if you press *6, you can also unmute by pressing *6. We will have questions and answers. At the end, depending on time. If you would like to pose a question, please pose it to the host in the chat box if you're online. If you send it to Bill Mills, myself, I'm not going to see it until after the presentation's over, because all you guys see right now. So if you present it to the host, then we'll be able to see it, and I can then present it to them. Also, please do not put us on hold on the call, because if you put us on a hold, we get to hear all your lovely hold music, and we'd rather not do that. So if we could, once again, I'll just, one more time, *6 for mute, and *6 again for unmute. With that, I would like to go ahead and get started. If you can, I wanted to go ahead and kick it off. We're going to send it over to Kay.
Well, thank you so much, Bill, and good morning and welcome, everyone. This is Kay Schmitz. I'm the president of the FPP, and I'm absolutely thrilled to see so much wonderful support for this topic this morning, something we're all very concerned about and interested in. So before we go any further, and I think, Bill, you can probably change slides now, we try to always recognize our funders. We'd be nowhere without them, and I know many of you on the phone do contribute to the FPP, and we always appreciate that, so thank you again. We do have a brand new funder that we just found out about, last week, I think. We were just able to get a State Farm Youth Advisory Board grant that we will use to work with financial education with 2 schools in Orange County in Orlando. And I think that will be a very exciting project, and we'll keep you posted on how that goes. We'll have something in our newsletter that comes out next week, and we'll be sharing information about that on our regional meetings as we go around the state to talk about them. And speaking of our regional meetings, I think that's on the next slide. There they are. We'll be doing regional meetings in all of these areas on these dates, and we invite all of you to come, whether you're actually a member of the FPP, a friend, or somebody who just heard about us for the first time. Please join us at least one of these locations or more if you happen to be somewhere and you can pop your head in. What we do at these meetings is we join with the local organizations, the local prosperity coalitions, and we just basically, talk about what's going on locally. We update with some national initiatives. We talk about what the FPP is involved in and how we can all work together. And then we also talk about, of course, our upcoming conference in 2014. And for those of you who have been with us before, you will know, how good those conferences are and how much fun we have. I keep talking about how much fun we have, but they're also extremely informative. We bring in a lot of speakers from all over the country, and in fact, this last time from the world, because we had Dr. Dong-Ho Jang from Seoul, South Korea, talking about what he learned last year when he came to visit the FPP, the University of Florida, and United Way Miami-Dade, and what he's been able to do with it back in South Korea. For the third year in a row, by popular demand, we're having the conference at the Lowe's Portofino Bay Hotel in Orlando, a wonderful, wonderful facility, and you can see the dates there. So as I said, when we go out to the regional meetings, we'll be talking about that and trying to encourage everyone to join us again. It's just really a great venue, and I believe it will be very worth your while. So with that, I'd like to say thank you again for joining us. Welcome, and I'll turn it back over to Bill.
Okay, great. We're going to go ahead and once again, if you have not muted your phone, you can press star 6. Star 6 will mute, and star 6-1.
Lady Rappaport, Family Success Administration, Broward County, Florida.
Okay, great. We have 4 speakers for you this morning. You can read all of their bios if you go to our website, once again, FloridaProsperityPartnership.org. Click on Members and Meetings, and then Meetings, and I'll have all their bios. So I'm not going to go through all of those. Otherwise, we'd probably spend half the time, because we have some really great speakers for you this morning. We do have Judy Solomon, who will be up first. She is from the Center on Budget and Policy Priorities, and she's going to speak on plan selection, decisions, perspectives, resources. Then we're going to have Daniela Levine from Catalyst Miami, and she's going to talk about the on-the-ground local perspective. And we have Kelly James from Florida Blue, who's going to give us an insurance industry perspective. And then Holden Weisman from the National Community Tax Coalition is going to speak on the basics of the Affordable Care Act and tax filing. So let's go ahead and get it started with Judy.
Hi, everybody. It's good to be with you from D.C. So Bill asked me to really just sort of sketch out some of the choices and issues that people may confront as they attempt to enroll in coverage in 2014. I'm going to do that using a few select slides that we've used at the center in a series of webinars we've been doing for the field. Very broadly, we've been getting around 600 or 700 people on these webinars to give the ins and outs of the Affordable Care Act. So I'm not going to use these slides in the way we do on the webinar, which is actually to teach content, but just to highlight for you some of the issues that people will have to confront, how they're going to have decisions to make, in Florida in particular, the pathways to coverage that do leave some people out, unfortunately, because the state hasn't expanded Medicaid, and really try to convey for you that the choices have real consequences for financial stability as well as health, because I think I know all of you are really focused on financial stability, and health insurance, of course, is a way of guaranteeing that people can have stability in their lives by protecting them from risk of healthcare expenses that are unanticipated or anticipated and regular. One thing I want to say, and I think Daniela in particular is going to be talking about this a lot, is that people are really going to need guidance and support because of these multiple decisions. And this morning in the New York Times, there's an editorial specifically about Florida, and it makes this point. It's as if it came to make this point for me. I commend you all to look at it around needing all hands on deck, because what the editorial really talks about is in Florida where barriers, roadblocks have been put in the way of getting people both the coverage they need through the Medicaid expansion, but also the help that they're going to need through things like not allowing the navigators to be at public health agencies in the counties and so on. So you really all, in some ways, have to be involved in this. So I'm going to move on now to these slides, and I'm going to probably go through them quickly. We have a lot of speakers, so if someone can move me to the next slide. Oh, then this, I can't click it, so you're going to have to just click if you do the first click here. So this basically gives a picture, and this is the national picture today on Medicaid, and these are median eligibility levels, which means that for each of them, half the states are above and half the states are below. But I can fill it in for Florida, which provides children's coverage up to 2 times the poverty line, pregnant women at that 185 level. Today, working parents in Florida are eligible if range. So, and then of course, people who don't have they are. So that's the picture today. The Medicaid expansion, what it would have done is fill in the gap here and cover everybody at least up to 133% of the poverty line. You're going to have to click it again. In fact, give it a couple clicks and we'll fill it in. Yeah, okay. And what you can see is that the exchange coverage sits on top of Medicaid, and people with incomes between the poverty line and 4 times the poverty line can get subsidies in the form of premium tax credits to help them buy coverage in the new marketplaces, and Florida is going to have the federal marketplace. And then if people have income above that level, they can purchase the coverage as well. And the whole point is that they're purchasing as part of a group, which brings the price of the coverage down. However, with the Supreme Court's decision, what was supposed to be a seamless system of providing a pathway to coverage for everyone has left some people in the coverage gap, and that exists in Florida. And so the people with income below the poverty line who are not eligible for Medicaid today don't have a pathway to coverage. The people with income above the poverty line can get the premium credits, but those below are left without a pathway to coverage until Florida gets that expansion through. And this is a very strange message that we now have to convey to people, that you're too poor to qualify for coverage. Okay, we can go to the next slide. So this slide illustrates, why don't you just click the whole thing through? It's probably easier, because I want to move through it pretty quickly. This is the slide that we use to show, to show the impact of employer coverage on premium tax credits. In general, if people have an offer of employer coverage, they're not going to be eligible for premium tax credits. However, there is an exception if the coverage is not affordable, and the test of affordability is based on the cost of coverage just for the employee, even if you're looking for family coverage. And if that cost is less than 9.5% of household income, it's considered affordable. And then there's also a test of the value. But I put this slide here just so that you can see that this is a counseling issue. For people who have an offer of coverage who feel that it's unaffordable, they're going to need some extra help to see if they can jump the firewall. Next slide. Again, you can just click it so we can get the whole thing up. These, as I said, are how we teach using them and go a lot more slowly in the webinar series. So this is a slide that we show about the kinds of plans that will be available in the marketplace. This is going to be standard, and actually plans offered outside the marketplaces and in the small group market will also be classified in this way. So if you go to the most precious metal here, which is platinum, that is a plan that has the lowest cost sharing. So people would pay, probably only about $5 or $10 when they go to the doctor. However, the premiums for that plan are going to be considerably higher. As you go down through the metals and get to bronze, the plans are cheaper, the premiums are less, but when you're going to have a higher deductible and so on. And it gets even more complicated because people with incomes below 2.5 times the poverty line can qualify for some extra help. They will enroll in a silver plan, but their silver plan will have lower cost sharing than the standard silver plan. So this, again, is just to show you the counseling challenge that people will have to understand and think through, what do I think I'm going to need? What's more important to me, that I have lower charges when I go to the doctor or I pay lower premiums? And we're going to play with that a little bit in the next few slides, so we can go to the next one. So this is our standard John. He is used in all of our webinars as the young single adult living alone, and here we're looking at the fact that young adults have particular choices, have actually more choices than other people because they have the ability to enroll in their parents' coverage when they're under 26. So if you just click through all the rest of the material on this slide, I can go through it pretty quickly. So as I said on the employer coverage, one of the first things that has to be explored is whether people have other ways of getting what's called minimum essential coverage. And that would include public coverage, so people who are eligible for Medicaid or children eligible for CHIP are not going to be eligible for premium credits, as well as people who have employer coverage. Now here, John is under 26, and he does have an offer of coverage through his father's plan. However, because he's an independent 24-year-old, he doesn't have to take that up, and he can, while he can join it, he still can get a premium tax credit on his own. So for John, he's going to have to weigh going into his father's plan. Is that good for him? Where is that plan located? Does it have the providers he needs? And then how much would he get? How much help would he get with a premium tax credit? And what would his choices be there? So let's look at the next slide, which gives you the choices that John has. In our example, John gets a premium tax credit of $1,748. His income in this example is, his countable income is somewhere around $22,000 a year, which is just around just under 200% of the poverty line. So this is to show you kind of, once he has that credit, the credit is calculated based on a benchmark plan and his income. He can take that credit shopping. So if he buys the benchmark plan that was used to calculate his premium credit, his share of the premium would be $1,270 a year. These are annual figures. However, he could buy a lower cost silver plan, and that would bring down his cost. The premium credit stays the same. So that's what I mean when I say you take that and go shopping. He can also buy a bronze plan, but as we saw, the bronze plan is going to have much higher cost sharing and deductibles, even though the premium is less. So he can buy that bronze plan, and then he can also buy a gold plan. Well, a gold plan would be a lot more expensive for him. And as we will see in the next slide, it really doesn't make sense for him to buy a gold plan because John is eligible for some help with cost sharing. So if we go to the next slide, and why don't you... And remember, the gold plan had an 80% value. And the values that we're talking about really measure across a typical population. The plan is going to pay versus the individual. It's not what John is necessarily going to pay. It's a big typical population in the aggregate that's with an 87% value. And you can see here what that would look like. These are just some samples. He could make a bronze plan, which would be risky and $5,000 for presented services and hospitals and other services. That's much less expensive than teaching. We also have which is really the backstop for people with high medical expenses. Once and cost. So you can see for John, there's really a good value he would get by what he wants to do and how much risk he and we'll take some speaker. Good here. And if you could just click through, this shows the same thing for a family, and just gives you a little more sense of the array of choices that a family may have. Just cover the in our webinar here. Here would be this to cover insurance. This is you see this was that would have. But if you just do that to the link, the system is the Under a Budget website, which has lots of great resources. It's a new website that we launched to house from our webinar series. YouTube videos, we've done sessions of last one was putting it all together, and it was an attempt to bring together through the use of examples, families and individuals, all of this material in one webinar. So you could start with that if you haven't seen any, but if you look at into any of the topics, you can see that. And if you want to have it followed, so anyway.
Well, thank you, Judy. I appreciate it, and we will go ahead and move on now to Daniela Levine from Catalyst Miami. Daniela?
Asking me is a work in progress for calling attention to the New York Times editorial. I've already posted it on my Facebook page. Not that we don't know it, we feel it, but it's good to have the nation aware of some of the extra challenges here in Florida. Let me say that my organization, Catalyst Miami, has as a major component the Prosperity Campaign, which is our arm for helping people learn about public benefits and a range of economic and income supports to improve their health and wealth. And in that regard, we have been very active in promoting access to health care, including Medicaid, CHIP, and other programs for many, many years. So it's a logical extension for us to be very active in promotion of the marketplace through the Affordable Care Act, and we also do play a big role in advocacy around these issues. So naturally, we're working to try to get the Florida State Legislature to support the expansion of Medicaid, which is the critical missing component for our state. Nonetheless, we're very excited about promoting access to the options in the marketplace, and we have, in fact, 10 staff members who are being trained as navigators, and we will be working under the umbrella of the Epilepsy Foundation of Florida to do that work. And as I get into my presentation, I'll explain that others are welcome to do the same, to work with one of the groups that receive the federal funding and perhaps under their auspices to also become navigators as well as to be able to serve as certified application counselors. So the nature of my presentation, and you can go to the next slide now, Bill. Right? Hello, Bill? Thank you. Is how in communities we can support people to learn about the benefits of the Affordable Care Act marketplace and the role that nonprofits and faith groups and really anyone who's interested in helping people to connect to necessary health care, the role that we can all play in getting the word out. And let me say, you can see on the bottom of this slide the Florida Chain logo. Florida Chain is our statewide healthcare advocacy group focusing on consumer voice and choice. We're very pleased to have played a role in the launch of Florida Chain and very proud of its wonderful work. And they are really leads, along with many others in the Florida Healthcare Alliance, in promoting awareness. So we have borrowed extremely liberally from their presentation. I want to shout out to Florida Chain, so I've left them on the slides. So, so you can see the whole point here is how do people get coverage, but how do they get the right health care coverage for themselves and their families? So go ahead, Bill, to the next slide. There are several different ways that the public can learn about the benefits, and I've listed here the 5 main ways. First is the navigators, which is the official designation through the Health and Human Services Department of the federal government. We'll talk more about each of these options. Next is the certified application counselors, and any organization or individual that has experience doing this kind of work can apply and be certified by HHS to serve in this role. The federally qualified health centers have received special funding to serve as well as certified application counselors, and so they are also playing an active role in assisting people to get the benefits of the marketplace. And people can just go themselves to the marketplace. So, people who are computer savvy and educated consumers can go there, learn all about their options in Florida. We have several excellent plans offered in Florida, so that information is available to anybody. And lastly, I included that any organization can become a champion, or any individual could become a champion. There's an official designation as such. I mean, you don't get a certificate, but you can call yourself a champion if you're willing to share resources and information. And that information as well is on the CMS website. Next slide, please. Okay. So the navigators are the ones, and we'll go through in a minute who in Florida is actually serving as navigators, that are designated and through a, is it a 30-hour training required to really be fully aware of all the choices and be able to help people walk through the kind of choices that Judy went over in her presentation. And, of course, they have to be unbiased. They can't be linked to any particular insurance company, but they are prepared to help people evaluate the options, as well as if they're eligible for Medicaid or KidCare, the CHIP program in Florida, to go ahead and assist them there. They, of course, also educate consumers and conduct outreach. They're obligated to do outreach about these programs as well, so that people can be aware and then come into the system for application support, and then they directly assist them with eligibility, enrollment, and health plan selection. If you could go to the next slide, please, Bill. So there are certain obligations that the navigators have. So obviously we're prioritizing low-income, disadvantaged, hard-to-reach populations, the uninsured. We need to help them understand the ins and the outs, not only of the best plan selection, but also the tax credits and how those work, and the potential impact on their overall family finance, and how the benefits and cost-sharing piece of the health insurance works, as well as any appeals in the law. And they are obligated to support people with limited English proficiency. Next slide. So these are the groups that have been have received dollars. It's not showing up on my screen, Bill. If you could be sure to advance it. Oh, yes, thank you. So these are the groups in Florida that have received dollars to support, and we have two slides of the groups. University of South Florida received the largest grant, operating out of the Child Center at University of South Florida. They've done this work for many years in the children's health arena particularly, and they created a consortium of state partners, 10 partners, and they have a particular carve-out in South Florida, but any way that navigators are accessible, they'll be accessible even to people in South Florida, but they're not doing a particular outreach effort in our region. And Epilepsy Foundation is a statewide organization, happens to be located in South Florida in Miami-Dade, and they cover 35 counties. So they're going to have an extensive presence around the state, and they're going to be working with schools and universities. Actually, specifically college students are going to be engaged in the outreach, as well as partnerships with government agencies, hospitals, and faith-based groups. Advanced Patient Advocacy is in multiple states and is also serving in Florida. If you could advance the slide. Knock, knock. The National Hispanic Council on Aging has designated Miami-Dade as one of their target counties, but they haven't yet hired anybody to focus on the work down here, but they are obviously planning and did receive a grant to do that. Cardon Healthcare Network, maybe some of you are aware, is actually not going to be participating and made some news by giving back their $800,000 grant, saying that the requirements then were too burdensome and would interfere with their ability to do the other work that they've been doing for a long time on Medicaid enrollment. And then Mental Health America is serving portions of the state of Florida. So those are our groups, and I can't speak to all of them, but I know because I've been working closely with Epilepsy Foundation that they are very open to working with others that want to come under their umbrella as a navigator, and so they're going to be promoting that so that more people will be able to report on their good work and enrolling people and complete the necessary training and certification. So here's a map that shows you all the groups and the territory covered. It's quite a challenge. I'm just from a South Florida perspective. We have the largest number and percent of uninsured, and the dollars that came to our region are quite limited, and so there's quite a local effort to try to bring in new dollars and see what we can do to really be sure to have a good presence. As well, I know many of the counties and regions have pulled together coordination meetings We had ours in Miami-Dade yesterday, convened by the Health Council of South Florida, with the idea that those who are providing both paid and volunteer assistance, including our qualified health centers, would all coordinate and have a shared information portal so that the public could get access, maybe even do appointment scheduling through our 211, which in Miami-Dade is switchboard. So I know there's quite an intention to cooperate, coordinate, and make sure that the public does have easy access and is not confused about the multiple ways to get access to the system. So if you could forward the slide, Bill. Let me mention, we don't have a slide about it, but Enroll America is a national nonprofit with a very big presence in Florida. We have, I think, 8 organizers just in Miami-Dade alone, and they are not doing enrollment, but they are doing outreach to be sure that people are aware, and they have a quite extensive volunteer pool as well. So they're going to be working around the state to make sure that people are directed to those who can assist them with application assistance. So here is the slide about the certified application counselors. Now, it really turns out that the CACs can do pretty much everything that the navigators can do, but they don't have the same level of certification or reporting obligations that navigators do. So navigators are very important so that we can really track our results, and there'll be quality assurance measures and the like. But certified application counselors can be, as I said, just about anybody with experience and knowledge that apply to HHS, conduct 5 hours of training. They have 5 hours of training and certified by HHS. There is no specific funding available, but these individuals can provide information about the full range of marketplace plans and help people to apply. They may conduct outreach, but they're not obligated to conduct outreach. So in our county, for example, we are encouraging everybody possible to become a CAC so that all of the traditional agencies where people go for social service assistance can be part of the network. If you could advance the slide, please, Bill. So again, if you have a track record and you're willing to be screened and get the training and be certified, you can become a CAC. Next slide. So here are some of the groups that are already or are in the process of becoming CACs, just so you can see how broad that is. As I mentioned, the community health centers actually, through a federal HHS grant, did get some dollars to support serving as CAC. Hospitals could serve other healthcare providers, other specific targeted healthcare providers, and as well a broad range of social services. My organization, Catalyst, is not a healthcare provider, but we assist with all kinds of application support, as do all of the Florida Prosperity Partnership members. So I'm really hoping that people on this call will step up and learn about on the CMS website how to become a certified CAC so they can help as well. Okay, next slide. Oh, no, excuse me. I just want to reference here. It was mentioned by Judy, and it is in the article, the editorial, that Governor Scott has said that the health department offices for the state will not be involved as navigators and will not actively enroll people. However, they will continue to provide public education, and so it's not like there'll be a vacuum. It's just that the more active support for enrollment will not take place through the state offices. Okie doke. And you can see libraries even are a good source where there's free access to computers. Okay, so the differences, I've really talked about this quite a bit already. Very similar. CACs have fewer requirements, but they are also able to assist without some of the stringent conflict of interest standards. So the navigators may not participate in any way that supports a particular health insurance provider, so they have to be free of any conflicts, and they don't have the same obligations to have especially target the needs of the cultural and linguistically challenged parts of the population. and they don't have to be particularly involved in some of the appeals processes or the like, but naturally a CAC would want to be fully aware of all of these options so that they can provide support. Okay, please, next slide. Okay, so I'm at the end of my presentation, and here's some resources to become a CAC. Oh, I don't think I am quite done. Okay, go ahead, Bill. Almost done? Oh, yes, very good. So here again, the federally qualified centers. There were quite a good number of dollars and people specifically doing the CAC work. Here in Florida, it's 163 new workers with a goal of almost 160,000 people to be enrolled. Go ahead, next slide. And here's the Florida Chain website. I want to point out that Florida Chain is keeping track of stories, both positive stories and challenges as well. So we want to encourage people, if you're not signed up to receive alerts from Florida Chain, to please do that, and also to participate in the story bank so that we can collectively bring more attention to some of the problems and successes. As well, I would encourage you to sign up for Catalyst Miami's newsletter. For example, we have an event coming up on October 4th to help people learn more about how they can become navigators, CACs, or champions. We're doing that in partnership with Florida Blue Foundation, so you can get that information on our website, catalystmiami.org. And then I don't want to leave out the fact that we are still working hard to fill in the gaps about the Medicaid expansion. This is, you saw it on the graph that Judy did, this is the big gap in coverage. Obviously, many people do not benefit from the tax credits and can't afford on their own to purchase insurance through the marketplace. So it is really essential for the full benefits of the Affordable Care Act that we expand Medicaid in Florida. There's tremendous support in the public to do this. The hospitals are aligned around it and other healthcare providers. The governor has said in the past that he would be supportive of Medicaid expansion, so we're hopeful that we'll be able to bring this matter forward. Please, next slide. And these are some of those that would benefit if we go ahead and expand Medicaid, which we obviously need to do. And people do not really understand that Medicaid, as it's currently implemented in Florida, is very restrictive. Adults without dependent children are not eligible. Adults even with dependent children have limited eligibility, and so the vast majority of the uninsured adult population is not currently covered, regardless of their low income in the state of Florida by Medicaid. So please, next slide. So we have some advocacy efforts underway, and we want to encourage people to participate through Florida Chain, through the Florida Healthcare Alliance. We have a unified campaign. And my screen just went blank. So, okay, next slide. So almost 3 million people will be eligible once we expand Medicaid. And there they are, happy, insured people. Next slide, please. Okay, so that's it. These are the resources, and these slides will be available on the Florida Prosperity Partnership website. So we hope that you will avail yourselves of them. And I think that's my last slide, Bill. Could you please just...
Yes, it is, Daniela.
More? Okay, very good. Well, thank you very much for your attention. Really appreciate it.
Thank you, Daniela. And now we're going to move to Kelly James from Florida Blue. Kelly, are you there?
I am. Thank you, Bill.
Okay, great.
Good morning, everyone. My name is Kelly James. I am from Florida Blue, and I'm going to talk to you a little bit about what we see in terms of impacts to the insurance market based on the Affordable Care Act, and also provide just a little bit of background on the Act itself. I know Judy and Daniela have both mentioned the Medicaid expansion. I'll talk about that as well as the key provisions of the law so everyone has a baseline of what the marketplace is going to look like for 2014, and then we'll talk about what we see as some of those impacts. So, Bill, if you can click through to the next slide, please. One more, I'm sorry. Both Judy and Daniela both mentioned the state's stance on the Medicaid program. I won't rehash that in any great detail, but just to reinforce the point that for those people who are under 100% of the federal poverty level, which is about $11,490 per year in annual household income, there is no federal or state assistance available for those individuals. And that is, as Judy mentioned earlier, that is a bad message to send to people in those situations. And so to Daniela's point, there is a lot of work underway to look at other alternatives and options that can be made available to that population. But those who are from 100 to 400% over the poverty level will be eligible for tax credits or subsidies in the marketplace once it opens for business on October 1st. Next slide, Bill. Just to recap some of the major changes that are taking place for health plans that individuals will be buying for 2014. If you look at these first three bullets in combination, essentially medical history no longer matters when people go to enroll in coverage. Guaranteed issue means that we have to offer coverage to anyone who applies. And guaranteed renewability means that for anyone who continues to pay their premium and doesn't commit fraud, we have to renew their health care. So the pre-existing condition and the guaranteed issue and renewability provisions expand the healthcare market to anyone that wishes to apply for coverage with no impact on their medical history, on their availability of coverage, or how much their premiums would be. Each of the plans starting in 2014 have to cover a series of essential health benefits. These include doctor visits, maternity services, ambulance services, prescription drugs, and classifications of services that have to be covered by all plans.
So you're getting a whole lot of it. Right? This guy's droning voice.
Those are like three different ones.
Put your phone on mute, please.
Full attention, huh?
Once again, if you press *6, you can mute your phone.
And I'll try to do a little bit better with my droning voice. But there are out-of-pocket maximums that have been established for plans to limit consumer responsibility for financial exposure. They're based on whether it's a single plan or a family plan, and those limits are much lower than what we have in many plans today. Judy mentioned the metal level plans. Those are just categories of plans that will be available. They all have to cover the same set of essential health benefits. They just differ in the cost sharing. And then the premium tax credits, those will be available in the marketplace based on household income. Next slide, Bill. Rating rules. How premiums will be determined in 2014 will be changed as well. Again, no pre-existing conditions, no medical history will be used. Instead, it will be based on three factors: how old someone is, what county they live in, and whether they are a tobacco user. There are age bands that are defined for children as well as adults. If you're a child is 0 to 20, you pay the same rate, 63.5% of the adult rate. Rates for adults start at 1.0 for a 21-year-old and increase to 2.95 as a rating factor for 63-year-olds. The idea is that the oldest person would not pay any more than the youngest person, and that factor is a factor of 3. And so there's a single factor for those 64 and over where they pay a 3.0 factor in terms of how much they pay for their premiums. The county where you live also matters. Your county affects of living, so your county factor in your rate. And if you use tobacco, you can be rated up to 50% higher for that tobacco use. If there are LPP families, then only the first 3 children under the ages of 20 will be rated in determining premiums. Next slide, Bill. Just an overview here of how the marketplace will work. It's essentially a 3-step process. Beginning on October 1st, when the marketplace opens in step 1, people will go onto the marketplace and complete an application for eligibility determined and figure out how much, if any, of a tax credit they qualify for based on their income and household size. In step 2, the federal government will respond to the applicant with information about their eligibility and how much of a tax credit they would be able to obtain. And then in step 3, the consumer then goes out to the marketplace and start shopping among plans that are available in their area. Open enrollment starts on October 1st, It closes on December 15th for those people who want their coverage to begin on January 1st. And open enrollment continues from December 16th through March 31st for future effective dates beginning in February 2014. Next slide, Bill. And then finally, the advanced premium tax credits are available for households that have incomes within 100 to 400% of the federal poverty level. What you see on the slide are examples of what those poverty levels would be for a single individual as well as a family of 4, and then the requirements for obtaining that subsidy. The individual must enroll in individual coverage through the marketplace. They cannot be enrolled in any other minimum essential coverage such as Medicaid, Medicare, or TRICARE, or coverage that's sponsored by their employer. If the applicant is married, they have to file a joint tax return in order to claim the subsidy. And the subsidies are paid to the insurance companies based on the plan the applicant selects. And then the insurance company bills the applicant for the balance due of the remaining premium on a monthly basis. Next slide, Bill. Well, given that as the framework in terms of what the market looks like in 2014, here's some information that we have come up with in terms of where we think the market is going. On the slide that's on the screen now, you'll see a dramatic growth in the individual marketplace in terms of people coming into the market to purchase coverage. In today's environment, there are about 880,000 people that are covered under individual plans. Our most conservative projections show that number doubling in 2014 and then continuing to increase in future years. So twice as many people are going to be looking to buy individual coverage starting October 1st and moving into 2014. So that presents a very significant expansion of people coming into the market. And then what you see with the different colors is what we project based on census data, where they will fall based on their income and the level of subsidy they would be able to obtain through the marketplace. Next slide, Bill. We have gathered information from the Florida Office of Insurance Regulation, and these are the companies that will be offering plans both in the individual and small group markets in 2014 through the marketplace. At the bottom of the slide is a link to the Department of Insurance website where this information is available, as well as some other background information. But what you see, at least on the individual market, is a large number of insurers who will be competing to offer plans to those newly eligible individuals coming into the marketplace. And then also extended competition in the small group market as well for those small employers who are looking to offer coverage for their employees. Next slide, Bill. One of the things that we have been very interested in is looking at studies that have been done by both Kaiser and Pricewaterhouse in terms of what these new employees coming into the marketplace look like from a demographic perspective. And both studies are very consistent in their findings. Many of these people coming into the marketplace as of 2014 are not likely to have health insurance today for whatever reasons, whether it's affordability or medical issues or lack of access to an employer. They are not likely to fully understand how health insurance works in terms of co-payments and premiums and co-insurance amounts. They are likely to qualify for subsidies based on their household incomes to assist with their health care premiums. We know they will be more racially diverse, and they are more likely to speak a language that is not English as their primary language. We also expect there to be an immediate demand for treatment of medical conditions as these new enrollees come into the market. And there is the potential that they will be either under or unemployed coming into the market. So that may have some impacts on their ability to pay premiums on an ongoing basis. We also have a separate study from Jackson that shows that over a third of the people in the state of Florida who would qualify for subsidies do not have a bank account at a financial institution. So that creates another challenge, not just for us, but also for providers in terms of dealing with these individuals and how not only do they pay their premiums, but how do they pay for any services they receive if they owe money to the providers. So we'll have to look at things like cash, money orders, prepaid debit cards, and other alternate methods of payment moving forward. Next slide, Bill, please. In terms of how we see it impacting the insurance market in general, again, as the other two presenters mentioned, low-income consumers in Florida will continue to have access issues. The state now expanding Medicaid affect anywhere from 800,000 to 1.3 million people, depending on whose statistics you use. And so they don't have access to either state or federal assistance to obtain coverage. Again, we expect significant growth in the individual market, looking at it to at least double in 2014. In terms of people who get coverage through a small employer, we expect that market to shrink over time because small employers are not required to offer coverage to their employees. There are no penalties assessed against them if they don't. And so those employees may be better off moving directly into the marketplace to buy individual coverage. So there is some concern that small group coverage starts to erode over time. For large employers, 2014, because of the delay in some of the penalties and reporting rules associated with large employers, we expect that to remain relatively stable, at least for this next year. But we do appear to be widespread rate increases when you look at making the plans more rich with benefits in terms of the essential health benefits, as well as some of the pediatric, dental, and vision benefits that are included. When you eliminate underwriting criteria and the taxes and fees that are also part of the Affordable Care Act, rates are going to go up essentially for everyone across the board. It's just a matter of degree based on current coverage and whether those people would qualify for financial assistance through the marketplace. One thing that will change very drastically is that you'll see insurance companies welcome people coming into their market with chronic conditions. There are risk programs and other incentives built into the system that will have insurers seeking out people with conditions such as asthma, diabetes, high blood pressure, and high cholesterol to bring them into their plans and then enroll them in wellness programs to get their conditions under control. And if they can show a demonstrated improvement in those people's conditions, then there are incentives from the government to improve people's health based on participation in those programs. So you'll see more of that in terms of active solicitation of individuals and more robust programs to help them manage those chronic conditions. Next slide, Bill. In terms of how it affects practices, both in the healthcare industry as an insurance company as well as physician practices, again, we expect to see a significant increase in inquiries requesting information about the law, how it works, some basic information about health insurance and how it works, information about the marketplace and how the subsidies are determined. We also expect that there will be a lot of time that needs to be spent with people helping them gather all the information they will need to complete a marketplace eligibility application. It is going to be very similar to the information that's used to file a tax return because they'll need demographic information about themselves and their dependents, as well as information about their income and any coverage offered by their employer. Given how complicated some of these inquiries and situations could be, we expect there to be longer time frames to handle those inquiries because of the level of information that needs to be shared with consumers. We also expect more non-English inquiries and significantly higher volumes of services once people become enrolled because they've not had conditions treated due to lack of coverage in the past.
Yes, ma'am.
And then finally, one thing consumers will need to keep in mind is that if they have a marketplace plan, they will be dealing directly with the marketplace. If they have changes to their income, changes to their address, changes to the dependents that are included on their coverage, because the marketplace is their system of record for enrollment purposes, and then the marketplace will then pass that information on to the insurers. Next slide, Bill. In terms of Florida Blue in the marketplace, we believe we're well positioned to serve Floridians because of how we have approached developing plans and premiums for the ones that will be in the marketplace.
267.
We are the one carrier that will be offering plans in all 67 counties in the state. We will offer plans at all metal levels, as well as catastrophic plans in all of our existing networks. Blue Options, here and Blue Select. Based on the information we've gotten from the state in terms of how the premiums have been set, we offer the lowest price silver plan in 50 counties around the state and the lowest price bronze plan in 50 counties in the state. We also have a number of resources that people can use to get more information. We have 11 retail centers located around the state. We have a 1-800 number that is a dedicated unit to handle healthcare reform inquiries. Right. And we have information on our corporate website at floridablue.com. Next slide, Bill. Finally, I just wanted to mention a couple of resources that are available to you. The first is our own website that I just mentioned at Florida Blue. We have information that includes an overview of reform, a subsidy estimator that people can use to estimate what type of a subsidy they might be qualified for in the marketplace. There are videos out here about how the marketplace works, and then the opportunity to either call us with the 800 number that's listed on the screen or send us an email to ask a question. And then next slide, Bill. I believe Daniela also mentioned this, but healthcare.gov is the official government website that will be used to enroll in the marketplace come October 1st.
Okay, that's my billing cycle is...
there's a lot of very good information that's already on the site that will help people understand what the law is and how it affects.
And the payment right now was for $341.51?
That is the extent of my... Thank you very much for this time.
Thank you. Thank you much.
All right. Thank you, Kelly. And once again, if you could press *6 on your phone to mute your phone, if it's not muted. And all right, next we have Holden Weisman from the National Community Text Coalition, NCTC. Holden?
All right, thank you very much. And go ahead and go on my first slide there. I just wanted to first mention to you all, just bring up the fact, so why is it so important for VITA programs in particular to be involved with healthcare reform and the implementation that's coming ahead? Well, the key, as you've probably gathered already, is that you are a repository of tax knowledge, and that is going to be key to connecting to healthcare. As this is being administered heavily through the tax code, you are a key linkage to a key point of knowledge that will link your clients together with the healthcare resources that they need. You also touch the key population that is going to benefit heavily from these reforms. So I'm going to kind of go through relatively quickly some of just the basic points that you'll need to know going ahead in the very near future, and then looking slightly further ahead down about a year or so. So if you could go ahead and go to the next slide, please. As you've already heard, open enrollment begins October 1st, and this first open enrollment period beginning this year is kind of a special one. It is an especially long one. It goes from October 1st of this year to March 31st next year, 2014. And what that allows is for a special one-time only overlap with the tax season for at least a period of time. In future years, this will only be from October 15th to December 7th. So there won't be an overlap with the tax season in future years. So again, this is a one-time only special opportunity to connect your tax clients during the tax filing season and touch them during the tax filing season while the open enrollment period for healthcare is also going on. So if you go to the next slide, there are several ways to actually then integrate, or you can choose to integrate this kind of reaching out to your tax clients and connecting them to healthcare reform and healthcare implementation through your programs. The most basic of which is to simply refer people to the other sorts of enrollment assistance that you heard earlier from the other speakers. That's just connecting, having a plan for directing people to a specific program, whether it's a program that you go out in partnership with directly, or just directing people to resources where they can find further information of how to connect to different programs. You can also choose to create a partnership with some of these programs and offer space within your own programs to house such a partnership where your program and your volunteers or your staff aren't necessarily the ones helping with enrollment assistance or applications, but house within your organization or within your sites a group that is doing that assistance. So it's just a more limited but in-house partnership. And then the final thing is to actually take the extra steps that was mentioned of becoming an application counselor and whatnot to actually do enrollment assistance, an option that's certainly available. But there's other things that you can think about doing as well that extends beyond the referrals. You can also think about data. Data is going to be kind of very important all around, and your clients are, especially being a population that are going to be going to be the touch point there, it's essential to collect as much data as possible. So you can begin thinking about possibilities for collecting data on people that are already covered for health insurance, people that aren't covered. You can ask questions on your intake form. This can all be used in future years to see what kind of levels of involvement you do want to have going forward. But it can also be used as kind of a pre-screening technique to make referrals for people that are in need of health coverage. And it could also be used to pre-screen if you are going to be having a partnership or doing enrollment assistance as well. So you can kind of do that work in advance. But the key to it all is that connecting clients to assistance and whatever level you're going to do it is the essential to making this a success. So if you can go ahead to the next slide. Just some key points to keep in mind on specifically the tax-related issues of premium tax credit that have come up repeatedly, that they come to us all the time about. Does a client need to have filed a return in the last tax filing season, the 2013 tax filing season, to get a premium tax credit next year with the insurance that they're going to purchase during this coming open enrollment period? The answer is no, they do not. That is not necessary. And will there be any penalties that can be assessed on clients on their taxes filed during the 2014 tax filing season for insurance coverage in the last year during 2013? And that answer is no. But something to be aware of and to make your clients aware of as well is that if they are going to be taking or claiming a premium tax credit during 2014, they will have to file a return during the 2015 tax filing season. That is very important, and I'll kind of touch on that a little bit more in a second. But if they don't, they could lose some eligibility for credit in future years. So it's very important if your clients are going ahead and accepting a premium tax credit to help cover costs during 2014, that they have to be aware that they'll have to file a return during the 2015 tax filing season. So looking ahead to the future tax filing seasons in 2015 in particular, this is where a lot of you're going to see a lot of the tax-related actions coming to your programs. The biggest one is going to be something called reconciliation, where your clients that have received a premium tax credit during 2014 are going to have to reconcile the amount that they claimed throughout the year, because this is an advanceable credit. They'll have to reconcile the amount that they claimed in the credit with the actual amount that was due to them on their tax forms based on their actual income that they earned during 2014. So there is a potential that they could potentially owe some money back, or in some cases receive a bigger premium tax credit than they had received throughout the year, so they might actually get some money back for them. During the 2015 tax filing season, this will also be the first time that penalty calculations will be assessed, particularly as a penalty for not having insurance. That'll be done, again, on the tax form itself. And 2015 is also, for the 2015 tax season, this is when we've been told that the IRS is going to become more heavily involved in preparing programs for what lies ahead. So fingers crossed, the IRS is going to be supposed to be providing further training assistance on what you should be expecting from clients, and will be providing further assistance of preparing you to handle these sorts of issues during the 2015 tax filing season. There are some other steps that can be taken in advance of this. One of the big things to do during 2014 and preparing for the 2015 tax filing season is to prepare your clients for making them aware that they will have to inform, if they do accept a premium tax credit during 2014, that if there's any changes to their income or their family situation, any major life events, that they'll have to keep in touch with the marketplace to make any adjustments as necessary. This is a way of kind of avoiding the possibility of owing more money come 2015 if there's a discrepancy between the amount of premium credit that they received and potential that they owe back. So it's very important that any sort of income changes throughout the year that they're keeping in touch with the marketplace administrators on their situations there. So that's one thing that you can kind of keep your clients or help clients with throughout the year and keeping them informed of. But if you just go to the last slide, I just want to give you my contact information there and also make a pitch that you folks in Florida are certainly not alone with being confused and inundated with a lot of information. And you can reach out to us at NCTC if you want to connect with programs in other states and find information on what some other VITA programs are doing in some other states related to healthcare reform. We also host a listserv that you can sign up for on our website, and you see our website information there. It's called ACA in the Tax World, and that you can post information through that listserv, post any questions you want, and share information, ask questions of other programs across the country about what they're doing, and get your questions answered, and just use it as a general forum. So, and you can always reach out to me directly via email if you have any questions on the national scale. And with that, I'm going to turn it back to you, Bill.
Great. Thank you so much, Holden. At this time, we will accept questions. If your phone is on mute, you can press *6 to unmute it. You can also pose questions in the chat box, but please don't send it to myself, Bill Mills, because I can't see the screen right now. So if you do pose them, just pose them to all participants. Are there any questions at the moment? Okay, in the meantime, I have a question for you, Holden.
Yes, good morning. Berenice Rappaport from Broward County, Human Services Department, Family Success Administration in Florida. In reference to providers in Broward County for the marketplace, the Obamacare insurance, the health insurance, any sites that we can refer in social services in Broward County for that certification and also presentations?
I happen to know, this is Daniela Levine, that Broward is particularly lacking in groups that are specific. There is one group that is involved, and is anyone on the phone from Broward? Let me look into that, and through Bill, I'll get you that information.
That would be very well appreciated, please, so I can probably initiate, the distribution of such a basic information now for 2014 around the corner.
Absolutely. Mm-hmm.
Thank you.
Great. And Holden, I had a question for you. With the tax season coming up, as we're preparing, I know we'll be getting questions at the tax sites themselves. If there was one thing that you would say keep in mind for us to talk about, what would that be?
That is a good question. Well, the key again is connecting people to groups that can help it, regardless of what level. So I think the best thing to have, the best knowledge to have going into the tax season before your sites even open up is knowing exactly what you are going to do to connect people. And if you're not doing enrollments directly on your sites, knowing where to direct people, so where to go. In terms of the tax-specific knowledge of what you need to prepare people for this tax season, I think, like I mentioned at the very end there, preparing clients to that are going to be accepting a premium tax credit, making them aware of, again, the filing need and going forward, and also the need to be aware of any income changes. That those are definitely key things to make clients aware of as you see them.
Okay, great. Thank you, Holden. Does anyone else have any questions?
Hey, Bill.
Okay, I have a question.
Can I ask a question?
Go ahead.
This is Kathy Tucker. Hey, how are you? How long do any of the participants think if these options the various plans aren't going to be officially published till October 1st, how long will it take independent or support groups to, analyze them and try and give some other support or context for suddenly getting all of these plans kaboom on October 1st?
Sure, they'll support groups will have it before.
So this is Judy. I mean, I can just take a little stab at it. I mean, I think the thing to remember is that coverage doesn't start until January, and people, as long as they enroll and pay that first month premium by December 15th, they can get coverage January 1. So I think, as we've thought about it, it seems to make sense for people to take their time, regardless of whether they can look at them even before October 1, but to really take their time and examine the plans, the different premiums, cost sharing, and the plans, the provider networks, trying to find plans that include the providers that are most important to them. The plans will likely have different covered prescription drugs, so making sure that, so all of that can take some time, and I think people will have that time if they, start this process in the fall. So I don't see that as, a big problem necessarily this year.
And this is Kelly from Florida Blue. I would agree with those comments. That's the one thing that we have been talking to our consumer audiences about, is that you have the benefit of this extended enrollment period to go through and review the plans that are being made available in your area. As Judy mentioned, make sure you check the provider networks, look at the benefits that are covered, what those financial responsibilities will be. So we think that there will be enough time for people to get familiar with those plans and make a decision that fits their needs.
Great. Thanks, Kelly. In fact, I have another question for you, Kelly. If your employer offers an insurance plan and you decline it, will you have the option to receive insurance through the exchange or not? And how will that impact your credits that you receive?
There will be rules that will be applied to employer coverage. It has to meet two conditions. Is it considered to be affordable, and does it provide minimum value? And I think this was discussed a little bit earlier in the presentation. If that coverage meets those two criteria, then you can refuse that coverage, and you can go buy coverage for yourself in the marketplace, but you will not qualify for the tax credit to help you purchase that coverage. If the coverage offered by the employer does affordability and value test, then that excludes the employee and their dependents from getting a premium tax credit in the marketplace to subsidize their cost of health insurance.
Okay. Any other questions at the moment? All right, I have another one. I'm not sure who it's for. If you can't afford the exchange plan nor your employer's plan, what are your options at this point in time? We talked about that gap that is there. What are the options at this point in time? Maybe Judy or Daniela?
Yeah. There are free clinics. The federally qualified health centers generally have a sliding fee scale. And there are safety net providers like our public hospitals. It's obviously not a great system, and I know some areas have more resources than others. There is a network of free clinics. There's now a state association of free clinics. Health Council of South Florida hosts that group. And but often there's a waiting list. Also, as far as prescription medication, there's often a way to apply for free medication through the different companies. But obviously, it's a big problem. It's a big gap.
So, Bill, were you also asking about whether the people will be subject to the penalty for not having coverage?
Well, that would be an add-on question, definitely.
Yeah, so anybody who would have been eligible for the Medicaid expansion in a state that's not expanding is exempt from the penalty. There's a lot of other exemptions from the penalty that they may have actually qualified for as well, having income below the tax threshold, not having a source of coverage that's affordable, and here affordability is uses a test of about 8% of income. So they don't really have to worry about the individual responsibility requirement, but that's not as Daniela alluded to, that's not a great thing. They still don't have coverage, but it's good that she was able to explain the resources that are out there for people.
Okay. I just received another question. How is the health care coverage affecting if you move to another state? So I guess how does it transfer if you move from Florida to Georgia or wherever you're going to move from? How will we be affected?
Well, each state... go ahead.
I'm sorry, this is Kelly again. Essentially, that would qualify the person for a new enrollment period in their new state. They would then go to their marketplace in their new location and go through the process of applying for coverage in that state's marketplace. And I'm sorry, I didn't mean to interrupt whoever.
No, that's exactly right. And then, the issue would be kind of if you went from Florida, to New York, for example. Obviously, New York is expanding Medicaid, and, the eligibility might be different, or you might become eligible where you weren't before. If somebody's income is in that overlap from 100 to 133% of the poverty line, they may have been premium credit eligible in one state that wasn't expanding, but in a state that is expanding, they actually would qualify for Medicaid. And usually when people move, their income also changes, so they would get a new assessment of their eligibility. And as Kelly pointed out, even though they might be in a period where the open enrollment period has ended, say it's next year in June, because of the move, they would have an opportunity to enroll in a new plan in the new state.
Send that out to everybody in the office.
Wonderful. Does anyone else have questions at this time?
Everybody can call in.
If you are eligible under your employer's plan and you still are under the 400% poverty level, are you also eligible for the tax credit?
No.
You get one or the other. You get either your employer's contribution or the tax credit. And you only get the tax credit if your employer's coverage doesn't meet those affordability and minimum value criteria we talked about earlier.
And if your employer does not contribute to your health plan?
Well, if they don't contribute to that health plan, then it would fail the affordability test. So that would then make you eligible for premium tax credit.
So if you have to think about it from the perspective of the premium credits are the backstop for people who don't have another pathway to coverage. So for people who are eligible for Medicaid, for children who are eligible for CHIP, for people who have an offer of employer coverage that's affordable and adequate, that it meets those tests, they are not going to be able to get premium tax credits, even if their income is in the range that would otherwise help them qualify. Now, Medicaid is different. Medicaid does not bar people from coverage if they have an offer of employer coverage or even if they're enrolled in that coverage. It just becomes, Medicaid becomes the secondary payer. It pays the difference in what's not covered or protects against cost sharing. But the premium credits are really sort of intended to be the backstop for people who don't have a pathway to minimum essential coverage.
Is this presentation available to the attendees?
Yes. If you go to FloridaProsperityPartnership.org, click on minutes, members and meetings, and then you click on meetings. You can find it there, or it will be posted under our minutes and presentations as well. If you on the screen, there is a direct link, and I've also put it in the chat box. Kelly, I have another question for you. You had mentioned that the rates for everyone will be going up. Is that correct? For most people, I guess, will be increasing. And basically, the question is, how will it affect the low-income population right now?
the general answer is that premiums will be going up. It all depends on what type of coverage people have today. What are they paying for that coverage? For example, if you have an individual policy today and you have different riders or endorsements that have been added to cover specific conditions that you have, you probably are paying a very high premium today. Once we move into these new plans that have to expand those essential health benefits in 2014, that may have the net result of either equalizing or reducing your premium. And there will be other examples where people are in a plan, such as a catastrophic plan as they are defined today, that essentially prevents against accidents and things like that. When they have to move into a plan that includes all these expanded benefits, then their rates are going to go up because they're getting more money, more benefits as part of their new health plan. The idea is that people who qualify for the premium tax credits will have those increases offset by those contributions from the government to help subsidize those premiums. So it will really depend on the individual situation and what access to coverage they have today and what that access looks like in the future and the amount of the subsidy they would be eligible for. So there are a lot of moving parts in trying to figure out exactly how much someone is willing to pay for their coverage in 2014. And that's why we think it's very important for consumers and the people who are assisting these consumers to understand the interplay between all these factors.
Recently I heard someone say that probably the biggest affected is going to be our younger population, one that had not normally would have bought insurance, and they're probably going to be the biggest affected by this as far as cost-wise.
That's true. That's what we have seen in study after study, that the young and healthy individuals in the market will have a premium increase that will then subsidize the premiums for older, sicker individuals. And the concern is that will you get enough of those young and healthy individuals in the market to buy insurance and contribute to the pool? Or will they opt out and pay the penalties?
Okay, well, thank you. We are now out of time, so I want to once again thank each of our speakers. You're absolutely wonderful, and I appreciate it. Once again, we will have all of this posted. I believe that it might be posted already. And if you have any questions, you can always email me at bill@floridaprosperitypartnership.org. If you have any specifics for any of the presenters or anything, I'll be happy to forward that on. Once again, bill@floridaprosperitypartnership.org. Thank you so much for joining us, and hopefully we'll see you at one of our regional meetings. Thank you.